Welcome to the Nursing Research Associate Training Program. I'm Jeet Ghosh, your instructor for this course, and I'll be guiding you throughout this journey. Today, we are embarking on Lesson 1, Fundamentals of Nursing Research and Evidence-Based Practice. Let's get started. This lesson forms the bedrock of your journey into research and scientific nursing practice. Learning objectives of this lesson. By the end of this session, you will understand what nursing research truly means and why it matters in modern healthcare. Be able to explain evidence-based practice, EBP, and how it integrates into daily nursing. Differentiate various research methodologies, qualitative, quantitative, mixed methods, and more. Recognize ethical principles essential to conducting responsible research. Most importantly, learn how to apply findings from research into real-life clinical practice. This knowledge is key for anyone looking to contribute meaningfully to the field of nursing through data-driven, ethical, and impactful care. Section 1, Introduction to Nursing Research. Let's start with the foundation. What is nursing research? Nursing research is not just reading articles, it's a scientific and systematic inquiry into problems faced in healthcare and nursing. The goal: to improve patient outcomes, develop better interventions, and use data to drive decision-making. For example, you might explore whether nurse-led education for diabetics improves blood sugar control. That's research in action. As a nursing research associate, your role includes designing studies and trials, gathering both numerical, quantitative, and experience-based, qualitative data, and translating all of this into clinical improvements. Think of yourself as the bridge between discovery and patient care. Section 2, Importance of Nursing Research. Why should we even care about research in nursing? Because research ensures that our care is evidence-based, not just tradition-based. Helps develop the best and most efficient protocols. Drives policy changes that can reshape entire healthcare systems. Keeps nurses engaged in lifelong learning. Here's a real-world example. Implementation of early warning systems in hospitals for detecting sepsis came from nursing research. And frequent hand washing. Research showed it cut hospital-acquired infections by 40%. In short, research saves lives. Section 3, Historical Evolution of Nursing Research. Now, let's take a quick journey through time. In the 1860s, Florence Nightingale used data to show how sanitation reduced mortality. By the early 20th century, nursing began to shift from observation-based care to evidence-based methods. After 1950, both qualitative and quantitative methods began to flourish. Today, research is deeply integrated into clinical trials, disease prevention, and health policies. Nightingale's work in hospital sanitation still influences infection control today. That's the power of nursing research across generations. Section 4, Understanding Evidence-Based Practice, EBP. Let's explore evidence-based practice, EBP. EBP means making clinical decisions using the best current evidence from systematic reviews or clinical trials. Clinical expertise, your knowledge and skills. And patient preferences, meaning their values and choices. Why does EBP matter? Because it reduces errors and improves safety, justifies care with science, not guesswork, and helps implement hospital-wide changes backed by evidence. EBP is your toolkit for modern, ethical, and high-quality nursing care. Section 5 Steps of the EBP Process. How do you practice EBP? Use these 5 steps. Ask. Formulate a clinical question using the PICO model. Acquire. Search quality databases like PubMed, CINAHL, or Cochrane. Appraise. Critically evaluate the research for strength and accuracy. Apply. Use what you've learned in patient care. Assess. Track the outcomes and refine the approach. This is a continuous cycle to keep your practice current and effective. Section 6. The PICO Model for Clinical Questions. PICO helps you build strong clinical questions. P. Patient, population, who are you studying? I. Intervention, what treatment or action are you testing? C. Comparison, what is the alternative or control? O. Outcome, what are you measuring? For example, does repositioning I reduce pressure ulcers? O. In bed-bound patients? P. Compared to *** air mattresses? C. Section 7, Types of Nursing Research. Now let's look at types of research. Qualitative. Focuses on lived experiences and meanings. Used in interviews, focus groups. Quantitative. Uses numbers and statistics. Think RCTs, surveys. Mixed methods. Combines both to provide a richer picture. Translational research. Applies lab findings into real patient care. Choosing the right method depends on your question. Section 8. Ethical considerations in nursing research. Ethics are at the heart of research. Key principles include informed consent, participants must understand and agree freely. Confidentiality, patient data must be protected under laws like HIPAA. IRB approval, studies need ethical clearance from a review board. Avoiding bias, keep the study fair and objective. Ethical failures can harm patients and discredit the study. Section 9. Barriers to implementing research in nursing. Research is great, but what stops it from being used? Time constraints, nurses are often too busy. Limited access, research articles may be behind paywalls. Resistance to change, people may prefer old methods. Recognizing these barriers is the first step to breaking them down. Section 10. Overcoming barriers to research implementation. So, how can we overcome those barriers? Teach research skills early in nursing schools. Give nurses free access to research through hospital libraries or online platforms. Get leadership support. If managers promote EBP, others will follow. Empowering nurses with resources and motivation is key. Section 11. Case study, EBP in action. Let's bring this to life with a case study. In 2018, a study showed that hourly rounding by nurses reduced patient falls by 40%. Based on this, hospitals introduced structured rounding protocols. This is a perfect example of EBP improving care outcomes through practical application. Section 12. Summary of key takeaways. To wrap up, here's what you should remember. Nursing research elevates patient care and safety. Evidence-based practice ensures scientific, accountable decisions. Ethics safeguard patient rights and scientific integrity. Identifying and overcoming barriers allows research to enter practice. With this knowledge, you're ready to critically assess, apply, and even lead research. Section 13. Quiz and discussion questions. Let's discuss. What is the difference between qualitative and quantitative research? How does the PICO model help in research? What are two essential ethical principles in nursing research? Take a moment to reflect, discuss in pairs, or write your answers for later feedback. Section 14. Conclusion. In conclusion, mastering nursing research and evidence-based practice empowers you to improve care, influence policy, and grow as a healthcare professional. You're not just a nurse, you are a scientist, a change maker, and an advocate. Thank you for your attention, and let's continue to explore how research transforms lives.